When should you call cancer treatment options and management? Well, let's say you're a cancer patient and you've heard of HER2 targeted therapies, but you don't think they're relevant for you. Maybe because you don't have breast cancer and you think that they're only for people with breast cancer. Or maybe your doctor says they tested you for HER2 and you were HER2 negative. Well, depending on where your doctor works, the cancer agency, and their own knowledge base, that may or may not be true. It used to be that only inherited HER2 mutations were tested for, which isn't relevant and really doesn't inform your treatment, so is quite useless. Some cancer agencies now are starting to test for somatic, that means kind of developed over a lifetime, HER2 mutations, but a lot of them are still working from outdated data. And what that means is it used to be the case simply because we didn't know better when this type of thing was initially approved for use in various countries. It used to be the case that if you didn't have a score of 3 plus for HER2, HER2 is scored in 0, 1, 2, or 3 plus. So it used to be if you had a 3 plus score, you were considered to be HER2 positive and you would be a candidate for certain HER2 targeted therapies. What we now know is even people with a score of a 1 plus have been shown in clinical trials with approved therapies to benefit greatly from HER2 targeted therapies. And a 2 plus score, what is historically known as equivocal, does also qualify you for access to those targeted therapies. So if you're not sure if you've been tested for HER2, we can find out. If you haven't been tested, but there are some excellent HER2 targeted therapies available at your cancer agency, it's worth being tested because it's not specific to breast cancer and it's not even specific to women. The HER2 gene is in every body and it's involved in about 30% of cases. In some types of cancer, even more. So it's definitely worth having that particular type of testing done. And if you have been tested and you have a score of a 1 plus or a 2 plus, it's important for you to get back to your doctor and say, hey, did you know that things have changed? And a 1 plus or a 2 plus can qualify me for HER2 targeted therapies now. It doesn't have to be a 3 plus. You'd be surprised how many oncologists do not know this. I run up against it every day. So we approach your oncologist with respect. They're busy. They can't know everything. This isn't a judgment on your doctor, but this is your life. And we want you to have as much information as possible and to always be on the best possible therapy. The most important thing is for you to find out as quickly as possible if you are a fit for HER2 targeted therapies. We're happy to help find out if this testing has already been run for you. We're happy to help advocate with your doctor if it has and if you qualify. And if you haven't had this test yet, regardless of your cancer type, again, more than 30% of cancer patients of all different types, men, women, colon, breast, prostate, all sorts of kinds, are candidates for this therapy. And it makes such a difference to your treatment outcome. So we're here to help you coordinate this test and then advocate with your treatment team for access to this therapy if you are a candidate.